you go a little bit further, a little more aggressive, you're going to have potentially skin necrosis, complications with healing, and all these issues, which makes it complete opposite of what you're trying to achieve.
They're a candidate for the surgery, but I'm not sure that they're going to get like the best possible result given their age or whatever else is going on. And then they'll shock you that they look amazing, heal super, super easily. A lot of the surgeries that we're going to be doing, seeing as though we're going to have people who are losing significant weight, will be different than the types of surgeries we're necessarily doing now, where it's closer to massive weight loss procedures instead of your standard tummy tuck. You're talking about either a lower body lift or a Fleur-de-Lis. So I think that those types of surgeries, which are typically reserved for the people who have like the largest weight loss due to surgical weight loss, I think we're going to start seeing them for people who are on the GLP-1s.
Yeah, 100%.
And I actually, I recently did a Fleur-de-Lis. I used your neo-umbilicus that you were talking about. And the reason I did it because she had a big hernia through her belly button. I mean, it was looked like a Vienna sausage coming through. That. So her belly button was definitely toast because I needed to close off the hernia. But I actually really like the neo-umbilicus, and it wasn't so much for the reasons that I thought I was going to like it, but I think that with the Fleur-de-Lis, one of the biggest issues is to get a good belly button, and the belly button is everything, right? When it comes to abdominal contouring, I feel like if you can't get a good belly button, you're just kind of sunk. But the issue with the Fleur-de-Lis, and for folks out there listening, this is the lower incision that you get with a standard tummy tuck, but then you also get the upper incision that runs from the pubic hair all the way up to the rib cage. When you're doing that vertical incision, you're bringing the skin in, which makes it physically want to pull away. So when you have your belly button stock that's sitting there, that skin comes together and unfurls it, widens it, makes it, no matter how small you make it, there's just this new added vector, which is horrible for what your final belly button is going to look like. But when you cut out your native belly button, use extra skin from the flaps that you're bringing and fold them in, not only is there not a scar around the outside of that, but you're actually tagging that skin down to your connective tissue. So it really kind of neutralizes that vector so you don't end up with this like stretched out, super wide belly button. I was like, I know I did that case specifically because she had a belly button hernia, and I'm like, maybe I should do this for everybody for this surgery because, I mean, she looked really, really good at a week. We'll see as we move forward, but I think that we'll see more of patients without surgical weight loss getting those types of procedures. So how we continue to improve and dial in those procedures, not just our standard tummy tuck, is really going to define how good we are at our jobs as we continue to move forward as we see more and more of these patients.
Yeah, totally. I think it's good to have all the tools in your tool belt too, and I think it will drive innovation in terms of what we do in plastic surgery. I think trying new techniques and, like I said, ways to better hide scars, better minimize tension. And we're always looking for these things, whether it's new materials like new sutures we're using, or there's barbed sutures, or whatever materials they may be. I think it drives innovation in our field. And I think that's one thing that really drew me to plastic surgery, and maybe that goes for you too. I'm Sean, I don't know that.
Yeah, I don't like to do the same thing every single day. Every time you see patients, you're like, okay, this looks really good. What's next? What's going to get us, further down the line, either for a better result or a more controlled result, so you're not surprised for one reason or another, knowing, what is going to happen with the patient and knowing, what's going to get you the most successful outcome consistently. That consistency is really important, because if you can get A+ results, but you're only getting it in like 30% of your patients, and the other 70% are having something that's, bringing the result down, it's like you want to be able to increase the percentage of folks.
Yeah, I think we walk a very fine line, and I think we've talked about this in one of our previous episodes, but, we, as plastic surgeons, you want to deliver, like I said, A+ results. And what does that mean for a patient? Obviously, if they're wanting a tummy tuck, they want ultimate contour, they want hidden scars, they want a beautiful belly button. But to get that, sometimes you really have to push the envelope and kind of walk that edge. If you go a little bit further, a little more aggressive, you're going to have potentially skin necrosis, complications with healing, and all these issues, which makes it complete opposite of what you're trying to achieve, And so I think it's like just this that's why I love this specialty, because they're just slowly fine tuning it. But everyone is different. So it's not like you have the same human that you're doing the surgery on 100 times to try and perfect it. No, you have just, everyone's totally different. Everyone's skin quality is different. Everyone, everything is so different every time. But you're still trying to find a way for every person to give them an A+ result, like you mentioned. And so,
get them to the same point. And people will surprise you either way, right? Every once in a while, you'll have like an older patient where you're like, they're a candidate for the surgery, but I'm not sure that they're going to get like the best possible result given their age or whatever else is going on. And then they'll shock you that they look amazing, heal super, super easily.